Ashley. I'll be your nurse today. I just performed hand hygiene, so now we can get started on your head to toe assessment. First, can you tell me your name and date of birth?
Mary Cole, October 11th, 1970.
So what brings you in today?
I've been having abdominal pain and bloody diarrhea for 4 days with a swollen abdomen.
How would you describe the pain?
It feels like a stabbing pain in my stomach.
When exactly did this pain start?
4 days ago.
Where is the pain located?
My entire abdomen is painful and swollen.
How long does the pain occur for?
It's been non-stop since it started.
What would you rate your pain on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain you've ever experienced?
A 9 out of 10.
Does anything help the pain or make it worse?
Sitting in a fetal position and walking hunched over has been helping the pain. It gets worse when I walk.
Has the pain been affecting your day-to-day activities?
Yes, it is hard for me to get up and do things because the pain worsens when I walk.
Have you noticed any sores or lesions in your mouth?
No.
Do you currently have a sore throat?
No.
Do you currently have any bleeding in your gums?
No.
Do you currently have a toothache?
No.
Have you noticed any hoarseness with your voice lately?
No.
Have you noticed any difficulty swallowing lately?
No.
Have you had any problems with tasting?
No.
Do you smoke cigarettes or drink alcohol?
No.
When is the last time you've been to the dentist?
Within the past 6 months.
How often do you brush and floss your teeth?
Twice a day.
How has your appetite been lately?
I have hardly had anything to eat because of the amount of pain I'm in. I've ate 1 meal a day for the past 4 days, if that.
Have you developed any recent food intolerances because of this?
No.
How have your bowel habits been lately?
I went from having 1 to 2 bowel movements a day to now having 5 to 6 because of my diarrhea.
Have you been experiencing any nausea or vomiting?
No.
Have you ever been diagnosed with any abdominal disorders?
Yes, I've had ulcerative colitis for 5 years, and also I'm anemic.
Do you have any family history of abdominal disorders?
No.
Do you take any medications to help with your symptoms?
I take Imodium 4 milligrams twice a day for my diarrhea.
What all have you eaten within the past 24 hours?
The only thing I've had is, a bowl of chicken noodle soup.
Now I'm going to take your vital signs. Next, I'm going to ask you some questions to assess your level of consciousness. So can you tell me where you're at right now?
I'm at the hospital.
Can you tell me your name?
Mary Cole.
Can you tell me the date and time?
It's 12 on November 19th.
And then finally, can you tell me what's going on right now?
I'm at the hospital so I can try to get some relief from my abdominal pain.
It looks like your cognition is normal and your speech has a normal volume, tone, and fluidity to it. Everything seems clear and fine with that. Also, it seems like your mood is very pleasant despite the pain that I know you're in. Next, I'm going to assess your eyes and your pupils by first shining a pen light in them to assess pupillary response, and then I'm going to have you follow my pen back and forth to assess your extraocular eye movement. Alright, and then can you follow my pen? Alright, so it looks like your pupils are equal, round, and reactive to light and accommodation, and also your extraocular eye movements are intact. Looking at your face, your facial features are symmetric, and I do not see any abnormalities there. Next, I'm going to look inside of your mouth at your mucous membranes to look for any abnormalities such as lesions or bleeding. Alright, I do not see any abnormalities with your mucous membranes. Next, I'm going to assess your skin. Just by looking at your skin, I do not notice any abnormalities in color. The skin of your upper and lower body on both sides are a uniform pale color with no erythema. Next, I'm going to use the palm of my hand to assess for any excessive moisture. Alright, I don't know any excessive moisture, so next I'm going to use the back of my hand to assess the temperature of your skin. Alright, I don't notice any abnormalities in temperature. I didn't notice any extreme heat or cold on your skin. Next, can I have you put your hands out like this so I can assess the color of your nail beds? Everything looks a uniform pale color on both of your hands. Next, I'm going to assess capillary refill by pushing down on your nail beds. and capillary refill was almost instant, so I know that is a normal finding. Next, I'm going to assess the nail bed color of your feet. Everything again looks a normal, uniform, pale color. And then I'm going to assess capillary refill once again by pushing down on your nail beds and releasing, and it was almost an instant capillary refill, so everything is normal there. Next, I'm going to assess your heart and heart sounds. First, by assessing your carotid artery in your neck. Alright, everything sounds clear in your carotid artery. I didn't hear any abnormalities or bruise or any things like that. Next, I'm going to listen to your heart sounds. So first, I'm going to listen to your aortic heart sound, which is located at the second intercostal space right of the sternal border. Alright, next I'm going to listen to your pulmonic heart sound, which is located at the second intercostal space left of the sternal border. Alright, now I'm going to listen to your Erb's point heart sound, which is located at the third intercostal space left of the sternal border. Alright, now I'm going to listen to the tricuspid heart sound, which is located at the fourth intercostal space left of the sternal border. Alright, now I'm going to listen to your mitral heart sound, which is located at the fifth intercostal space at the mid-clavicular line. Alright, everything seems normal with your heart sounds. I didn't notice any abnormalities. Lastly, I'm going to listen to your apical pulse for a full minute. Apical pulse is located at the second intercostal space at the left mid-clavicular line. Alright, your apical pulse was 110, which is a little fast. Next, I'm going to assess your respiratory rate by counting your respirations for a full minute, so just sit there and breathe as you normally would. Alright, so your respiratory rate was 20, and for the most part, these breaths seemed unlabored and had a regular rhythm. Next, I'm going to listen to your posterior breath sounds. So when I do this, just take a deep breath in and out. At each point, I put my stethoscope on your back. So first, take a deep breath in, and then out, and then repeat for each of the different points. Now I'm going to assess your lateral breath sounds. So raise your arm for me, thank you. And then breathe in, and then out. And then one more over here. Alright, now I just need to do your other side. So again, lift your arm. Alright. Alright, now I just need to listen to your anterior breath sounds. Alright, all of your breath sounds seem clear. I didn't notice any adventitious breath sounds or anything abnormal. Now I'm going to ask you to lay down so I can inspect your abdomen. Alright, upon inspection, your abdomen looks smooth with no presence of striae, lesions, or any scars of any sort. Now I'm going to listen to your abdomen and your bowel sounds. Alright, so I did notice that your bowel sounds were a bit hyperactive, which is probably just due to your diarrhea. Next, I'm going to palpate your abdomen, so when I push down, just let me know if that causes any pain, okay? Alright, does that hurt?
Ow. Ow.
Does that one hurt right there?
Ow.
Alright, so as noted, your abdomen is very tender. I noticed that it was very distended, but I did not feel any masses or anything to be concerned about. Alright, next I'm going to check your pulses. So first I'm going to check your radial pulse for 30 seconds. Alright, and now your other one, your other radial pulse. Alright, now I'm going to assess your dorsalis pedis pulse on top of your foot. Alright, and then your other pulse. Alright, now I'm going to assess your posterior tibial pulse. so all of your pulses look good. Next, I'm going to check for any presence of edema on either the lower part or the upper part of your body by pressing into your skin. Alright, I do not see any edema, either pitting or non-pitting, so you're totally good with that. Next, can I have you stand up so I can assess your range of motion? Alright, so first, can I have you bend your neck to the left and the right? And then can I have you bend your neck forward and then backward? And then can I have you bend your back backward and then down and touch your toes? And then can I have you bend your whole body to the right and to the left? And then can I have you swing your arm out and then back in, and then the same thing with the other arm. And then can I have you swing your arm back behind your neck like this, and then other arm, and then back behind your body. Same thing with the other arm. And then can I have you bring your hand up to your face like this, and then back down, and then same thing with the other one. And then can you place your palms up like this, and then turn them over? Good. And then separate your fingers, make a fist, and then can you make a wavy motion with your hand? Alright, good. Now can I have you lay down so I can assess the range of motion for the lower part of your body? So first, can you lift your leg up into the air? Alright, and then the other leg. And then can you bring your heel up to your knee? Alright, good. Now for the other one. And then can you rotate your hip outward? And then for the other one. And then can you rotate it inward? Good. And now for the other one. And then can you move your leg away from your body? And then bring it back in. And the same thing for the other one. Can you bring your knee up towards your face? Alright, good job. Now about the other one. And then now for this, I'm going to have you actually lay on your stomach. And then can you bend your leg and bring it up towards your back? Alright. Now for the other leg. Alright, now I'm going to have you come back on to laying on your back. And then can I have you flex your feet and then point them and then rotate them in, rotate them out, and then move them side to side. Alright, good. Your range of motion all seems normal. Now I'm going to assess the strength of your feet and your lower body. So I'm going to force against your feet on the bottom, and then you need to push back against me. Alright, good. Now can I have you sit up so I can assess the strength of your upper body? You're just going to shrug your shoulders while I push down on them. Alright, so everything on your strength looks normal. Now for the last part of the head to toe assessment, I'm just going to have you walk in a straight line, heel to toe, so I can assess your gait and balance. Alright, everything with your gait and balance looks fine, and I will see you next time.
Thank you.